I was having problems for about 5 years with stress incontinence when I'd sneeze or I'd pick up something heavy or in playing sports. But it just increased in intensity. So I decided it was time to try something.
It was a huge disruption in all my activities, whether it be swimming or exercising, kayaking, skiing. It was just really a difficult situation. Now it's no longer an issue for me.
These women are describing their former problems with stress urinary incontinence, or SUI. They're among the many women who have benefited from the new Renessa treatment, a non-surgical therapeutic option for the millions of women who experience this common problem. Stress urinary incontinence is leakage of urine caused by the increased abdominal pressure of such simple actions as coughing, laughing, or sneezing.
I see many women that come in complaining of this. It's especially common in women that have had children, but I even see women that have not had children that have stress incontinence. The most frequent complaints I hear from women are that they leak when they cough and sneeze, or when they jump or lift or strain. They complain that the stress urinary incontinence is interfering with their day-to-day activities. They cannot do things with their families. They cannot do their activities. They can't do things with their children. They're starting to stay home more. And so these limit their activities, and that's why they seek treatment.
I had to be prepared before I went anywhere. If I was going to play sports like tennis or golf, I would have to make sure that I had pads or that I would take extra clothing in case there was an accident.
I suffered since 1994 when I had my first child, and I thought maybe it would resolve itself, and the stress incontinence it never resolved, it just continued. So I just 2 years ago sought consultation with my doctor.
It's been very interesting for me because as a urologist that specializes in female urology, I see women all day that have difficulty with urinary incontinence. But I am also one of those women, and I have 3 children myself, and I have difficulty with stress urinary incontinence. Yet I'm very busy. I have a very busy practice, and I have a very busy home life, and I really don't have time to take off for surgery, and I'm not ready for a big surgery yet. So I've been looking for a treatment that would be available that I could have done with minimal downtime. The Renessa radiofrequency treatment is a significant advance for us in the treatment of stress urinary incontinence. I think it's important that the patients know that they now have another option that's available to them for treatment of their stress incontinence without having to jump into a big surgery, and they have an option that's available to give them improvement without having to think about taking a lot of time off of work, without having to take a lot of time away from their family, and it's something that they can do, and they can be home the same day and resume all their normal activities. When they come to the office, the procedure is done on the examining table, and we use some Novocaine or some lidocaine just like the dentist to numb them up. The procedure involves a catheter treatment using the Renessa radiofrequency catheter.
The catheter is placed in the urethra and the bladder, and the procedure itself takes about 20 minutes. A balloon at the tip of the catheter is inflated to help hold it in place. The Renessa treatment involves the controlled heating of small tissue sites at the base of the bladder and within the urethra, after which the catheter is immediately removed. The heat denatures collagen in the tissue at these treatment sites. Upon healing, these treated sites increase resistance to involuntary leakage at times of increased abdominal pressure, reducing or eliminating SUI episodes.
This is a very well tolerated procedure. The patients are generally amazed that it is not very uncomfortable. They are awake. They are interacting with me and with my nurses. I have had patients that have been amazed that they felt nothing. The procedure is a walk-in, walk-out procedure. They are out of the office within 15 or 20 minutes after the procedure concludes.
It was very, very easy. There was no pain, absolutely no pain at all. They said not to do any vigorous lifting or any heavy lifting, anything like that, for about 3 days. And I felt so good when I came home that it was hard to remember what I shouldn't do. I had no bleeding, I had no pain, I had no burning. It was just like I had not had anything done.
I was expecting to have some discomfort because, as it was explained to me, there might be some mild discomfort involved with the procedure. I was fortunate and had no discomfort. I actually had the procedure done in the morning, and I was home by noon, and I went back to work the next morning. So it was great.
The patients may resume normal activities the same day. I typically recommend that if they can, they go ahead and take the rest of the day off. Just that way, if they do happen to have any frequency or urgency of urination that day, that they have the rest of the day off, but they don't have to. And then the recovery time, they can expect that it's going to take about 2 or 3 months for them to see their maximal benefit from the treatment. Some patients are immediately better, and some patients will slowly get better over the 2 to 3 month period. And some patients will be just about the same for the whole 2 to 3 months, and then they'll suddenly get better. And overall, about 75% of the patients are improved.
Adverse events following the treatment may include dysuria or pain on urination, hematuria or blood-tinged urine, urinary tract infection, retention, meaning you're unable to empty your bladder, worsening incontinence due to overflow incontinence, overactive bladder, or intrinsic sphincter deficiency.
I noticed the results immediately. It was very surprising because I thought it would take longer. When I started playing tennis again in 3 days, I didn't even wear a pad. So it's been wonderful for me.
Personally, I noticed a difference within 3 to 4 weeks of having the procedure. So it was fairly quick. I had to remember what it was like prior to the procedure on how disruptive stress incontinence was. And then as 3, 4, 5, 6 weeks went along, I noticed, wow, you know, this is not a problem for me. This is great. You know, I'm jumping, I'm outside, I'm exercising.
I had my treatment in January, so it's been almost 5 months. My hopes for treatment with the Renessa radiofrequency treatment were that I would have improvement in my incontinence. I did not expect to be perfectly dry, but what I was looking for was an improvement, and that is exactly what I got. I am personally approximately 75 to 80% improved, and I'm very happy with that. I thought that the treatment was very easy to have done. It was easy to go ahead and go back to work the same day, and which I did. I had the treatment done and then went right back to work that afternoon. It definitely has changed the way I talk to my patients because I have firsthand knowledge of what the treatment is like. I have firsthand knowledge of what the follow-up is like. I have firsthand knowledge of the expectations for the treatment.
Great.
And so I feel like I can really speak to them about what they can expect with the treatment.
I'm a very active person, and I have grandchildren, and I have activities like tennis and golf and bike riding. My husband and I have an RV and we travel quite a bit. So it's important for me not to have to even think about bladder conditions. Let's hope we get some fish this time. I'm doing everything again like years ago.
What's so different for me now is how long I can engage in an activity without having to stop and take a break. I can go for long walks with the dogs, I can go for long boat rides or long kayaking, I can be out with the kids playing, and it's just not an issue. It's the way it was previous to having children.
I still see many patients that have been told, even by their family doctor, that this is a normal part of aging, that this is something that they have to accept, and that there is not going to be any treatment for their stress urinary incontinence. And people will come in and they're very concerned, or there's a lot of anxiety around the incontinence, again, because it's not socially acceptable to discuss it. And it's very interesting that in our society, it's very socially acceptable to discuss chest pain around the dinner table, but it's not socially acceptable to discuss stress urinary incontinence around the dinner table, even though it's probably a more common problem.
I'm so pleased with the procedure, the Renessa treatment that was done. I now know that there's a way to stop the incontinence. So I'm not embarrassed by having incontinence. And if This is a problem that I think might even be happening to other people my age after having children or hysterectomies and all of that. I bring it up, and it immediately perks up their interest, and they'll ask me questions, and so we do talk about it much more often now.
My life has changed because now I can start to do some of these activities that I could not do before. And I am not so worried that I might leak, or that I might leak through pads or leak through my clothing. And I don't feel that I have to worry so much about where the next bathroom might be, or to make sure that I'm empty, or to make sure that I have extra clothing in my office or my car.
In just a few short months, I've gone from having such a huge disruption in my daily life to barely noticing any issues at all anymore. So I'm very happy with the procedure, and I recommend it to, and have recommended it to several people.
I would say to any friend or anyone who ever told me about having an incontinence problem that check out the types of procedures that are available, and don't wait as long as I did. I waited 5 years. Don't let it interfere with your fun time.